There is one specific shape, one particular appearance, that if you have been seeing it in the toilet over the past few weeks and dismissing it as nothing, may be the most important detail I tell you today. It doesn't hurt, it doesn't bleed, it doesn't announce itself with pain, fever, or any of the symptoms we typically associate with something serious. It simply continues to appear quietly, day after day. And most people who notice it assume it's probably related to something they ate and move on. Some of them are right, some of them are not. I'm Dr. Mandel, and I have been practicing medicine for many years, working extensively with older adults. I have sat across from countless patients who came in for something entirely routine, a blood pressure check, a follow-up appointment, or a prescription renewal, and almost as an afterthought mentioned that they had been noticing something unusual in the bathroom for quite some time, but weren't sure it was important enough to mention. And I've had to look them in the eye and say, that was absolutely worth mentioning. In fact, that was the very thing you should have brought up much sooner. Not because I was trying to alarm them, but because it was true. Here's what I've come to understand. Your digestive system leaves behind a physical record of what is happening inside your body every single day. Color, consistency, shape. Each one carries information, and some of that information is so specific that a physician can use it to identify a condition that has not yet produced a single symptom anywhere else in the body. The problem is that almost nobody has ever been taught how to interpret it. The conversation rarely happens during the average medical visit. There often isn't enough time, or the subject feels uncomfortable, or physicians assume patients already know what is normal. As a result, decades go by, and people flush away this daily record every morning without ever looking at it, not because they are careless, but because no one ever told them it was worth paying attention to. That changes today. Over the next several minutes, I am going to explain what your body may have been trying to tell you through that daily record. We'll discuss what normal actually looks like, what common changes may mean, which colors deserve immediate attention and which ones usually do not, and which stool shapes, when persistent, should prompt a visit to your physician without delay. By the end of this video, you will have a framework that many people go through an entire lifetime without ever learning. I encourage you to stay until the end, because the most important sign, the one I believe is most frequently missed and most often misunderstood, is something I will discuss later, and it has the potential to completely change the way you think about this subject. I'm Dr. Mandel, and one question has guided much of my clinical thinking throughout my career. What is the body already trying to tell us? Not the dramatic symptoms that send people to the emergency room. Those usually take care of themselves. I'm talking about the quiet signs, the ones that appear weeks or even months before anyone begins paying attention. If this is your first time visiting the channel, I invite you to subscribe. I publish new videos every week, and I believe that important health topics deserve more than a superficial explanation. This is certainly one of them. Before we can discuss what is abnormal, we first need to understand what normal looks like. Because you cannot recognize a departure from normal if no one has ever explained what normal actually is. And when it comes to this topic, most people genuinely have no baseline. What you want to see on most days is stool that resembles a sausage or a smooth, slightly curved log. Soft but formed, not watery, not crumbly, not so hard and compact that it is difficult to pass. Ideally, it should pass without significant straining, without discomfort, and without leaving you with the unpleasant sensation that you haven't completely emptied your bowels. And it should be brown. That brown color is not accidental. It has a very specific biological origin. Your liver produces a digestive fluid known as bile, which is stored in the gallbladder and released into the small intestine whenever you eat foods containing fat. Bile helps break down fats so that they can be absorbed through the intestinal wall. Interestingly, bile is actually green at its source, distinctly green. Not pale green, not muted green, a genuine, noticeable green. If you could observe it when it is first produced, it would probably look nothing like something you would expect your body to make. But bile travels. It moves through the entire digestive tract, a distance much longer than most people realize. As it moves, bacteria interact with it. Digestive enzymes continue to work. Complex chemical reactions take place. And when everything proceeds as it should, when transit time is appropriate, when intestinal bacteria are functioning properly, and when nothing is accelerating or slowing the process excessively, the final result is brown. The color we recognize, the color that tells us the digestive system has completed its work as intended. Soft, formed, brown, passed without straining. That is your baseline. Keep that picture in mind, because everything else I discussed today represents a departure from that baseline in one way or another. The first thing most people notice when something seems unusual is consistency, whether stool is too hard or too loose, and those two extremes often tell very different stories. Hard, dry stool that breaks apart into small pellets, often compared to pebbles or rabbit droppings, usually means that stool remained inside the colon for too long before being passed. One of the colon's primary functions is to absorb water from the material moving through it. That is both normal and necessary. However, when intestinal transit slows down, the colon continues removing water beyond the point that is helpful. It keeps extracting moisture. As a result, what was once soft and manageable becomes dry, compacted, and difficult to pass. Mechanically, this is constipation. But the word itself doesn't fully capture what is actually taking place. Constipation may result from dehydration, something that becomes increasingly common after the age of 60 and is frequently underestimated. Many older adults consume far less water than they realize, partly because the sensation of thirst becomes less reliable with age. Thirst is already an imperfect signal in younger adults. It becomes even less dependable later in life. Low dietary fiber can also contribute, as can certain medications that slow intestinal motility, including some blood pressure medications, certain pain medications, and iron supplements. Another contributing factor may be diverticular disease, a condition in which small pouches develop within the wall of the colon over many years, often related to insufficient fiber intake. These pouches can occasionally trap stool and interfere with the smooth movement of intestinal contents. What many people do not realize is that hard, pellet-like stool is not merely uncomfortable. Over time, repeated straining increases pressure within the colon and pelvic floor, leading to additional complications. It can worsen hemorrhoids. It can weaken pelvic floor muscles. It can cause small tears in the tissue surrounding the anus, making future bowel movements even more painful and difficult. It becomes a self-perpetuating cycle. At the opposite end of the spectrum is diarrhea. And here I want to be very precise because there are two forms that people often treat as identical when they are not. Loose stool lasting a day or two after a heavy meal, a course of antibiotics, a stomach virus, or food that simply didn't agree with you is often the digestive system reacting to a temporary disruption and correcting itself. The body has systems designed to handle temporary disturbances, and in most cases they work remarkably well. Rest, adequate hydration, and a little time are often all that is needed. Most of the time, the problem resolves on its own. But diarrhea that persists for more than 4 weeks is an entirely different situation. At that point, the body is no longer simply adjusting, it is failing to return to its normal baseline, and the reasons behind that failure can vary widely. Chronic inflammation of the intestinal lining may be responsible. A parasitic infection that the immune system has been unable to clear may be the cause. And in some cases, a tumor somewhere along the digestive tract may be irritating the intestinal tissue and disrupting the normal rhythm of movement. None of these possibilities improve simply because enough time passes. If loose stool has become part of your daily life for an entire month, The solution is not a different probiotic. The solution is a physician who can investigate why your digestive system has not returned to normal. Color is where the digestive system leaves some of its clearest clues, and it is also the area where most people have virtually no framework for interpretation. Green stool is probably the color that worries people the most, when, in reality, it often shouldn't. A diet rich in leafy green vegetables such as spinach, kale, broccoli, or any deeply green food can easily shift stool color in that direction without indicating anything serious. The chlorophyll contained in these foods may simply be present in sufficient quantity to influence the final color. Green stool can also occur when food moves through the digestive tract unusually quickly, not allowing bile enough time to complete its transformation from green to brown. The journey becomes shortened and the color remains green. On its own, this is not usually dangerous. However, if it continues to occur without an obvious dietary explanation, it is worth mentioning to your doctor, as it may suggest that your digestive tract is moving material faster than it should. Pale stool is much more clinically significant. Clay-colored stool, yellowish stool, or stool that appears almost chalky and contains very little of the brown color we expect deserves careful attention. When stool lacks its normal brown color, it usually means that bile either failed to reach the intestine in adequate amounts or was not produced properly in the first place. Brown comes from bile. If bile is absent or unable to reach the intestine normally, the stool reflects that absence. The possible causes range from a blockage in the bile ducts to liver dysfunction, to disorders involving the pancreas, which plays an essential role in fat digestion and works closely with the bile system. A parasitic infection known as Giardia can also produce this exact type of pale, greasy, foul-smelling stool. None of these conditions can be reliably expected to resolve on their own, and none should simply be dismissed as a dietary issue. Sometimes pale stool is accompanied by another important feature, a fatty or greasy appearance. You may notice stool that appears oily or leaves an oily ring floating in the toilet bowl. This condition is known as steatorrhea. It indicates that fat is not being absorbed properly. Fat that should have been broken down and absorbed through the intestinal wall instead passes through the digestive tract unchanged. This may occur because the pancreas is not producing enough digestive enzymes, because there is insufficient bile, or because of diseases affecting the intestinal lining itself. It is not a dramatic symptom. Most people notice it briefly and think little of it, but it is a meaningful sign that something may be interfering with fat digestion, and it deserves medical evaluation. And then there are two colors that should immediately overcome any hesitation you might have about seeking medical attention. The first is black stool, not dark brown, which is common and usually harmless. Black, the color of tar. Sometimes thick, sticky, and accompanied by an odor that is unusually strong and distinctly different from what you consider normal. When stool looks like this, what you are often seeing is digested blood. When bleeding occurs in the upper digestive tract, the esophagus, stomach, or the first portion of the small intestine, the blood travels through the entire digestive system along with everything else. By the time it leaves the body, it no longer resembles blood. It has been transformed into something dark, thick, and unmistakable. Possible causes include bleeding stomach ulcers, severe gastritis, and a condition known as esophageal varices, enlarged blood vessels within the esophagus that can rupture, often in association with liver disease. Any one of these situations constitutes a medical emergency. This is not something to monitor at home. It is not something to casually attribute to the iron supplement you recently started. Although iron supplements can darken stool, they do not produce the tar-like appearance and distinctive odor I have just described. If your stool is truly black and tar-like, you should seek medical evaluation immediately, preferably on the same day. The second warning sign is bright red blood. Blood that is clearly visible in the toilet bowl, coating the outside of the stool, or appearing on toilet paper after wiping. This type of bleeding usually originates from the lower portion of the digestive tract, the sigmoid colon, the rectum, or the tissue near the anal opening. Because the blood has not traveled very far, it has not undergone digestion. It remains bright red. Hemorrhoids are a very common and usually benign cause of this type of bleeding. And I want to be fair